Good morning, everyone. Welcome to our presentation. Today, we are excited to introduce the HSS Q6105 Arogya Mitra program. Over the next few minutes, we'll explore what this initiative is all about and how it aims to improve healthcare services. Let's get started. Ayushman Bharat, also known as Pradhan Mantri Arogya Yojana or AB-PMJAY, is actually the world's largest government-funded health assurance scheme. It was launched on September 23, 2018, and since then, it has been a game-changer in the realm of public health. The scheme offers cashless and paperless coverage, which makes accessing healthcare much easier for the beneficiaries. Each family covered under this scheme can receive up to 5 lakh rupees per year for hospitalization related to secondary and tertiary care. Now, that's a significant amount, designed to cover serious health issues without burdening the family financially. And who benefits from this? Over 12 crore poor and vulnerable families across India, which translates to roughly 55 to 60 crore individual beneficiaries. This means that a large portion of our population, who previously might have faced barriers to quality healthcare, now has access to essential medical services without the worry of huge expenses. So, in essence, AB-PMJAY is about providing financial protection and healthcare access to those who need it most, aligning with our overall goal of a healthier, more equitable society. Let's take a closer look at the financial coverage provided by AB-PMJAY. Each eligible family receives a health cover of 5 lakh per year, which primarily supports secondary and tertiary care hospitalization. This means that if someone needs specialized or advanced medical treatment, the costs are covered up to this limit, easing the financial burden on families. Now, focusing on the target beneficiaries, the scheme aims to reach around 10.74 crore poor and vulnerable families, both in rural and urban areas. That's approximately 50 crore individuals, all identified based on the HSSC 2011 data. This data-driven approach helps ensure that the most needy populations are prioritized. An important feature of AB-PMJAY is that there are no restrictions on family size, age, or gender. This means every member of an eligible household is covered, regardless of their circumstances. It's a comprehensive approach to ensuring health coverage for entire families. And perhaps most importantly, the scheme offers cashless and paperless access to healthcare services. Beneficiaries can receive treatment without paying out of pocket at any empaneled public or private hospital across India. This significantly reduces the financial and administrative barriers to accessing quality healthcare, making the scheme truly inclusive and accessible for those who need it the most. Let's take a closer look at some of the key features of the AB-PMJAY scheme. First, the portability feature means that once you're enrolled, you can access services at any empaneled hospital across the entire country. So, whether you're in Delhi or a remote village in Kerala, your benefits follow you. This ensures that healthcare is truly accessible no matter where you are. Next, the scheme offers extensive coverage. It includes over 1,300 medical procedures, which range from surgeries and medicines to diagnostic services and intensive care, including ICU. Additionally, it covers costs for 3 days before hospitalization and up to 15 days after discharge, helping to reduce financial stress related to treatment. One of the most important aspects is that pre-existing conditions are covered right from day one of enrollment. So, if someone has a chronic illness or a condition they've been managing, they can access care without waiting periods, making the scheme more inclusive and comprehensive. Finally, the scheme is managed by the National Health Authority, or NHA, in partnership with state health agencies. This collaboration ensures smooth implementation and efficient delivery of benefits across different regions, aligning with the overall goal of making quality healthcare accessible to all. Now, let's take a closer look at AB-PMJAY and how it compares to private health insurance. AB-PMJAY is a government-funded health assurance scheme designed specifically for the poor. It provides an annual coverage of 5 lakh for secondary and tertiary hospitalizations. The best part is, it's accessible to over 12 crore families without any premium cost. There's no age limit either, so people of all ages can benefit, and it also covers pre-existing conditions, which is a huge advantage for those who need it most. On the other hand, private health insurance typically offers higher coverage amounts and a wider network of hospitals, which means more choices and convenience. It also often includes outpatient benefits, or OPD coverage, which can be very useful for regular health needs. However, private insurance usually requires paying premiums, and there are age restrictions that might limit eligibility for some people. So, the key difference here is that AB-PMJAY is designed to be accessible and comprehensive for the underserved, while private insurance offers more extensive coverage options, but with certain costs and restrictions. Understanding these differences helps us see how each can serve different segments of the population, aligning with our overall goal of improving healthcare access for everyone. AB-PMJAY, or Ayushman Bharat Pradhan Mantri Arogya Mitra, is a centrally sponsored scheme that works in close collaboration with the states and union territories. It's designed to be a federal initiative, meaning the central government partners directly with over 32 states and UTs to deliver health coverage. The idea is to create a unified, nationwide approach to health insurance. Under this scheme, each eligible family gets coverage of up to 5 lakh rupees per year. This is a significant amount, aimed at reducing the financial burden of secondary and tertiary care. What's really interesting here is how flexible the scheme is. States can choose their preferred implementation model, whether that's a trust model, an insurance model, or a mixed approach. Funding is also adaptable, with contributions split in a 60, 40, or 90-10 ratio between the central and state governments. This allows states to merge their existing local health schemes into one comprehensive program, making administration easier and more efficient. Plus, all of this runs on a common IT platform, which helps ensure transparency, ease of access, and seamless portability of benefits across different states and providers. So, whether someone is in their home state or traveling elsewhere, they can access cashless, secondary, or tertiary care without hassle. Overall, this alliance with the states is what makes AB-PMJAY a truly collaborative effort, aimed at expanding healthcare access and improving outcomes for millions of families across the country. Now, let's talk about the role of the Arogya Mitra. An Arogya Mitra is a certified frontline healthcare service professional who will be present at the empaneled healthcare provider, or EHCP. Think of them as the first point of contact for beneficiaries coming in for care. Their primary role is to assist and guide beneficiaries through the process, ensuring they receive the support they need right from the start. The Arogya Mitra focuses on 3 key areas. First, they operate the beneficiary identification system. This means they identify and verify whether the beneficiaries are eligible under the AB-PMJAY scheme. It's an important step to ensure the right people get the benefits. Second, they handle transaction management. This involves submitting requests for pre-authorizations and claims, making sure that all the paperwork and procedures are completed smoothly and efficiently. Third, the Arogya Mitra guides beneficiaries about the overall benefits available under AB-PMJAY. They also provide information on how to receive prompt and quality treatment at the EHCP. In essence, the Arogya Mitra is the friendly, knowledgeable face that helps beneficiaries navigate the healthcare process, making their experience as smooth and beneficial as possible. Now, let's take a closer look at how we will select the Arogya Mitra. The first key point is that the candidate must have completed their 12th standard from a recognized board. This ensures that they have a solid basic educational background. Next, it's essential that they have completed the Pradhan Mantri Arogya Mitra training course and successfully passed the respective exam or certification. This confirms they have the necessary training and knowledge to perform their duties effectively. Another important criterion is communication skills. The candidate must be fluent in both English and Hindi or the local language. Clear communication is crucial, especially when interacting with the community and healthcare providers. Finally, they should have adequate functional computer literacy. This means they should be comfortable using Microsoft Office Suite and navigating through internet portals, which are integral to their daily tasks. All these criteria together ensure that the Arogya Mitra is well-equipped, knowledgeable, and capable of effectively supporting the healthcare initiatives. This selection process aligns with our overall goal of delivering efficient and accessible healthcare services. Now, let's move on to Slide 9, where we focus on the crucial roles and responsibilities of the Arogya Mitra. First, beneficiary identification and verification involves searching for beneficiaries in the database, which is a vital step to ensure accurate and quick processing. We then validate their identification using official documents like Aadhaar or Family ID, which helps confirm their eligibility. Once verified, we generate the AB-PMJAY e-card, often called the Golden Record, which is essential for smooth cashless treatment. Next is transaction management. Here, the Arogya Mitra initiates and processes pre-authorization requests, making sure that the necessary approvals are in place before treatment. They also manage and submit claims for cashless treatment, ensuring that the entire process is seamless and efficient. Then we have help desk operations. The Arogya Mitra operates a 24/7 help desk within hospitals, serving as the frontline support to guide patients. They provide important information about the scheme, answer queries, and help facilitate smooth, cashless treatment experiences. Moving on to patient support and counseling. The Arogya Mitra plays a vital role in educating beneficiaries about the scheme's benefits. They guide families to the appropriate medical coordinators and offer counseling to ensure everyone understands how to access and utilize the scheme effectively. Finally, documentation and grievance handling involve managing patient complaints, maintaining accurate records, and coordinating between patients, hospitals, and insurance providers. This ensures transparency and helps resolve issues promptly. Overall, the Arogya Mitra acts as a bridge, making the entire process more accessible, transparent, and efficient for everyone involved in the scheme. Thank you so much for taking the time to be here today. I really appreciate your attention and engagement throughout this presentation. I hope you found the information insightful and useful for your own work or projects. Remember, the key points we've discussed, from the main concepts to the practical applications, all tie back to our overall goal of improving understanding and fostering innovation. If you have any questions or want to explore these ideas further, please don't hesitate to reach out. Once again, thank you very much for your interest and participation. I look forward to connecting with you again soon.